Here's some more terminology. So the prognosis, once we get this information from our physical exam, our laboratory tests, and our imaging studies, then we can come up with a prognosis, a diagnosis, and then a prognosis. So a prognosis is basically the predicted course or outcome of a disease, how well the patient may do. It may give us the chance for complete recovery, or maybe permanent loss of function, or probability of survival. And then other words that go along with the course of the disease. Acute refers to a disease that has a sudden onset and short duration. So diseases like influenza, for example, or the common cold, they have a sudden onset but a very short duration, relatively speaking. Chronic diseases have a slower onset. They have a less severe onset. Usually they say about 6 weeks or more, but they last a lot longer. So they can last several months or several years. So diseases like arthritis or heart disease or diabetes have a much more insidious or less severe onset, but they last for much longer. And these diseases, these chronic diseases, are a significant cause of death in the US. Terminal refers to diseases that end in death. So you've probably heard of terminal diseases. Some cancers are terminal. Some other diseases that end in death are referred to as terminal. Remission, a disease that has gone into remission, that's a period of time where the signs and symptoms of the disease disappear, but the disease is not considered cured. So all the signs and symptoms are gone, but the disease markers are still present. So the disease can actually come back. It can reappear after several days, months, or years. So some diseases like leukemia can go into remission, but the person is not said to be cured because it can come back. Exacerbation, this refers to acute episodes where the signs and symptoms of the disease come back, and they can be severe. So diseases like asthma can have these acute episodes where the person will have episodes of shortness of breath. We say that's an exacerbation. COPD, the chronic obstructive pulmonary disease, that can have acute exacerbations where they have these sudden episodes of shortness of breath, difficulty breathing, but then they will get better. So those episodes are exacerbations. Relapse refers to the return of the disease. That could be weeks or months after an apparent cure. And again, leukemia is one of those diseases where it will seem to go into remission, but then it can relapse, where the disease will come back. It could be weeks, months, or years after an apparent cure. Complications of a disease. This is a related disease or other abnormal state that develops when a person who's already suffering from a disease has issues that could be related to the initial disease. So, for example, if a patient has a severe fracture of their leg and they're confined to bed, and then they develop pneumonia because they're immobile, that pneumonia is a complication of the fractured leg. So the complication is related to the initial disease, but it's not a direct cause. And then sequela refers to the aftermath of certain diseases. So certain diseases cause other diseases, if that makes sense. So for example, rheumatic fever causes permanent heart damage. Polio causes paralysis. So the heart damage is a sequela of the rheumatic fever, and the paralysis is a sequela of polio. So one follows the other. All right, more vocabulary. Like I said, this beginning chapter, there's a lot of vocabulary in here, so I want to make sure you guys get it because we throw these terms around a lot in the coming chapters. So mortality and morbidity, incidence, prevalence, and epidemiology. These we hear a lot about, especially in the news lately when we're talking about large disease numbers, right? Especially with COVID-19, lots of these numbers are being thrown around. So mortality has to do with the number of deaths caused by a disease. So basically the number of people who have died due to a disease. Morbidity is the number of cases, how many people have the disease. So morbidity and mortality usually go together. How many people have the disease, and then mortality is the number of deaths. Incidence and prevalence, these are a little bit harder to understand. These are statistical terms. So now we're talking about the number of diseases in an entire population. So these are a little bit more general. So incidence is a statistical term that refers to the number of newly diagnosed cases of a disease. So again, it's a huge number and it's a statistical term. So it's the newly diagnosed cases of a disease. Prevalence, again, is a statistical term. It's the total number of cases in an existing population. So how prevalent a disease is in the entire population. And then epidemiology, this is the study of disease in a population. So the study of the occurrence, the transmission, distribution, and control of a disease in a population. Again, those last three are statistical terms. Etiology, this refers to the cause of disease. So now we're talking about causes of disease. So for example, influenza, the cause of the disease is the influenza virus. When we're talking about AIDS, for example, acquired immunodeficiency syndrome, the etiology is the virus. Pathogenesis refers to how the cause of the disease leads to the anatomical and physiological changes in the body that ultimately results in the disease. And then idiopathic, that just simply means that we don't know what causes the disease. The cause of the disease is unknown. So these are some classifications for the chief causes of disease. So this is how we classify various causes of disease. So pretty straightforward here. Hereditary just means the cause of the disease is an abnormality in genes or chromosomes. Congenital means that the disease is present at birth, which could mean it is hereditary or it was acquired during the development in the uterus. Degenerative means the disease comes from wear and tear over time, something like osteoarthritis, which is just a wear and tear of the cartilage. That's a degenerative disease. Inflammatory, autoimmune, or allergic just means that it's an abnormal immune function. So inflammation results, autoimmune, where the body attacks its own cells, or allergic, it's a result of histamine response, like hay fever. Infectious diseases are caused by pathogens like bacteria or viruses, which is what we commonly think of as disease. So those are the most common things that we associate with disease, but these others, hereditary, congenital, degenerative, those are also disease categories. Neoplastic, these are cancers, both benign and malignant. So abnormal cell growth can lead to tumors. And remember, benign tumors can also cause problems because they can enlarge and press on other structures that can lead to problems in function. Metabolic diseases are things that have a disruption in normal metabolism. So things like diabetes, that's a metabolic dysfunction, which is certainly a very disruptive disease. Traumatic diseases result from physical or chemical injury. And then nutritional diseases result from either an overconsumption or underconsumption of nutrients. So deficiencies in like vitamin D or vitamin C can lead to nutritional diseases. Risk factors for disease. Risk factors basically increase a person's chances for developing a disease, but the risk factor does not equal the etiology. It doesn't equal cause. So just because a person has risk factors, that doesn't mean that they will get the disease. It increases their chance for developing a disease, but it doesn't necessarily mean that they will get the disease. However, if they reduce their risk factors, it does decrease their chance for getting their disease. And the list of risk factors is here. So environmental, chemical, physiological, psychological, and genetic. Risk factors that are modifiable can lower risk for premature death from chronic disease. So these are the modifiable risk factors. So things like poor nutrition, lack of physical activity, tobacco use, and excessive alcohol consumption, all of those things are things that we can change. We can improve our nutrition, we can increase our physical activity, we can stop using tobacco, and we can decrease our alcohol consumption. So by reducing our risk factors, we can increase our chance for living a better, healthier life. So health promotion and disease prevention. These are some of the tips that are kind of globally across the board recommended to be healthy and promote wellness. So being active, eating healthy, maintaining a healthy weight, don't smoke, limit the alcohol, getting recommended screening tests and immunizations, and then managing stress. You're all in college, you're not managing stress. And then finally, treatment of disease. There's 4 different categories for the treatment of disease. And treatment can either aim to cure disease or reduce the severity of the signs and symptoms. So, for example, we can't cure the common cold, but we take medicine to reduce some of the signs and symptoms. Palliative care just aims to provide comfort and relief. Pain medicine, or we'll take antihistamines to relieve the congestion or sneezing associated with the common cold. That's just palliative care. Pharmacologic treatment of disease is just medical care that uses drugs to either cure or relieve signs and symptoms. That's referred to as pharmacologic care. Surgical care requires surgery to correct or remove abnormalities, physiological or anatomical abnormalities. And then psychiatric or psychological, this is using therapeutic treatments for mental health disorders. So those are the 4 main categories, and some cases require a combination of treatments. So you may use surgical and pharmacologic interventions to treat disease. A lot of them combine surgical and pharmacologic treatments. All right, so that is it for chapter 1. Thank you for your attention, and I look forward to talking to you again in chapter 2.